Discover the powerful potential of Plaquenil as we delve into its uses, benefits, and potential side effects. This comprehensive guide will provide you with the knowledge needed to make informed decisions about this medication. Plaquenil, also known as hydroxychloroquine, has gained attention for its versatility in treating various conditions. From autoimmune disorders like lupus and rheumatoid arthritis to malaria prevention, Plaquenil offers a range of applications. In this video, we will explore the various uses of Plaquenil and highlight its benefits. You'll learn how it works to alleviate symptoms and improve quality of life for those suffering from autoimmune diseases. The potential side effects will also be examined, ensuring you are well informed on the risks and precautions associated with this medication. Whether you're a patient curious about Plaquenil or a healthcare professional seeking clarification, this guide will equip you with the essential information you need. Let's unlock the power of Plaquenil together and discover how it can positively impact lives. Understanding Plaquenil, what it is and how it works. Plaquenil, or hydroxychloroquine, is a medication commonly used to treat autoimmune diseases such as lupus and rheumatoid arthritis. It belongs to a class of drugs known as antimalarials, originally developed to combat malaria. However, the unique properties of Plaquenil have made it a valuable tool in managing various conditions. Plaquenil works by modulating the immune system, reducing inflammation, and suppressing overactive immune responses. This mechanism of action helps alleviate symptoms such as joint pain, swelling, and fatigue experienced by individuals with autoimmune diseases. Additionally, Plaquenil has shown promise in preventing and treating certain types of malaria. The precise way Plaquenil exerts its effects is not fully understood, but it is believed to interfere with the communication between immune cells, preventing the release of inflammatory substances. By dampening the immune response, Plaquenil helps reduce damage to tissues and organs caused by autoimmune attacks. Understanding the underlying mechanisms of Plaquenil's action is crucial in appreciating its uses and potential benefits. In the following sections, we will explore the specific medical conditions Plaquenil can treat and delve deeper into the advantages it offers. Medical conditions treated with Plaquenil. Plaquenil has proven to be effective in managing a variety of medical conditions, primarily autoimmune diseases. Let's take a closer look at some of the conditions for which Plaquenil is commonly prescribed. Lupus. Lupus, or systemic lupus erythematosus, SLE, is a chronic autoimmune disease that can affect multiple organs and systems in the body. Plaquenil is often prescribed as a first-line treatment for lupus due to its ability to reduce inflammation, minimize flares, and prevent long-term organ damage. It can help alleviate symptoms such as joint pain, skin rashes, and fatigue, improving the overall quality of life for lupus patients. Rheumatoid arthritis. Rheumatoid arthritis, RA, is a chronic inflammatory condition that primarily affects the joints. Plaquenil is commonly used in combination with other disease-modifying antirheumatic drugs, DMARDs, to manage RA symptoms. It can reduce joint pain, swelling, and morning stiffness while slowing down the progression of joint damage. Plaquenil may also have a positive impact on reducing fatigue and improving overall physical function in individuals with RA. Sjogren's syndrome. Sjogren's syndrome is an autoimmune disorder characterized by dryness of the eyes and mouth. Plaquenil can be prescribed to alleviate symptoms such as dry eyes and dry mouth by reducing inflammation in the affected glands. It may also help manage joint pain and fatigue often associated with Sjogren's syndrome. Malaria. Plaquenil's antimalarial properties make it a valuable tool in preventing and treating malaria. It works by interfering with the growth and reproduction of the malaria parasite in the body. Plaquenil is often recommended for individuals traveling to regions where malaria is prevalent to prevent infection. In cases of malaria treatment, Plaquenil is typically used in combination with other antimalarial medications to maximize efficacy. These are just a few examples of the medical conditions Plaquenil is commonly used to treat. It's important to note that Plaquenil should always be prescribed and monitored by a healthcare professional who can assess the specific needs and risks of each individual patient. Benefits of using Plaquenil. The use of Plaquenil can offer several benefits for individuals with autoimmune diseases and those at risk of malaria. Let's explore some of the key advantages associated with this medication. Symptom relief. One of the primary benefits of Plaquenil is its ability to provide relief from symptoms of autoimmune diseases such as lupus and rheumatoid arthritis. By reducing inflammation and dampening the immune response, Plaquenil can alleviate joint pain, swelling, fatigue, and other symptoms associated with these conditions. This relief can significantly improve the quality of life for individuals living with chronic autoimmune diseases. Disease progression prevention. In addition to symptom relief, Plaquenil has shown promise in preventing disease progression in some autoimmune conditions. By reducing inflammation and suppressing the immune system, Plaquenil can help slow down the damage to tissues and organs caused by autoimmune attacks. This can lead to better long-term outcomes and potentially prevent irreversible organ damage. Malaria prevention and treatment. Plaquenil's antimalarial properties make it an effective tool in preventing and treating malaria. For individuals traveling to areas where malaria is prevalent, Plaquenil can be prescribed as a prophylactic measure to prevent infection. It is also used in combination with other antimalarial medications for the treatment of malaria. The ability to prevent and treat malaria with Plaquenil has significant implications for individuals traveling to high-risk regions. Well tolerated. Plaquenil is generally well tolerated by most individuals and has a favorable safety profile when used as prescribed. The most common side effects are usually mild and include gastrointestinal symptoms such as nausea, diarrhea, and stomach cramps. Serious side effects are rare but can include retinal damage, especially with long-term use. Regular eye examinations are recommended to monitor for any potential ocular complications. By understanding the benefits of Plaquenil, individuals can make informed decisions about its use in consultation with their healthcare provider. However, it is essential to be aware of the potential side effects associated with this medication, which we will explore in the next section. Potential side effects of Plaquenil. While Plaquenil is generally well tolerated, like any medication, it does carry a risk of side effects. It is crucial to be aware of these potential side effects and discuss them with a healthcare professional before starting Plaquenil. Some of the possible side effects include gastrointestinal symptoms. The most common side effects of Plaquenil are usually mild and involve the gastrointestinal system. These can include nausea, diarrhea, stomach cramps, and loss of appetite. These symptoms are generally temporary and can often be minimized by taking the medication with food or adjusting the dosage. Skin reactions. In rare cases, Plaquenil can cause skin reactions, such as rashes or itching. It is essential to promptly report any skin changes to a healthcare professional to determine the appropriate course of action. Ocular complications. One of the most significant potential side effects of Plaquenil is retinal damage, known as hydroxychloroquine retinopathy. This side effect is rare but can occur with long-term use of the medication. Regular eye examinations are crucial to monitor for any signs of retinal damage, and if detected, the medication may need to be discontinued to prevent further complications. It's important to note that these side effects are relatively uncommon, and the benefits of Plaquenil often outweigh the risks. However, it is crucial to have open and honest discussions with a healthcare professional to assess individual risk factors and carefully monitor for any potential complications. Dosage and administration guidelines for Plaquenil. Plaquenil is available in tablet form and is typically taken orally. The dosage and administration guidelines may vary depending on the specific medical condition being treated, the severity of symptoms, and individual patient factors. It is essential to follow the prescribed dosage instructions provided by a healthcare professional. Some general guidelines for Plaquenil usage include lupus and rheumatoid arthritis. For the treatment of lupus and rheumatoid arthritis, the usual starting dose of Plaquenil is 400 mg to 600 mg daily, taken in divided doses. The dosage may be adjusted based on the individual's response to the medication and any side effects experienced. It's important to note that it may take several weeks or months to experience the full benefits of Plaquenil in managing autoimmune symptoms. Malaria prevention and treatment. For the prevention of malaria, Plaquenil is typically prescribed at a dosage of 400 mg to 600 mg once weekly. The medication should be started 1 to 2 weeks before entering a malaria endemic area and continued for 4 to 8 weeks after leaving the region, as advised by healthcare professionals. The dosage for the treatment of malaria may vary depending on the severity of the infection and other factors. It is crucial to adhere to the prescribed dosage and continue taking Plaquenil for the recommended duration, even if symptoms improve. Abruptly stopping the medication can lead to a recurrence of symptoms or a potential increase in the risk of malaria infection. Regular follow-up appointments with a healthcare professional are essential to monitor the effectiveness and safety of Plaquenil treatment. Precautions and considerations when using Plaquenil. Before starting Plaquenil, it is important to discuss any pre-existing medical conditions, allergies, or medications being taken with a healthcare professional. This will help identify any potential contraindications or interactions that may affect the safe and effective use of Plaquenil. Some important precautions and considerations to keep in mind include retinal examinations. Regular retinal examinations are essential for individuals taking Plaquenil, especially with long-term use. These examinations help monitor for any signs of retinal damage and ensure early detection and intervention if necessary. It is crucial to communicate any changes in vision or visual disturbances to a healthcare professional promptly. Drug interactions. Plaquenil can interact with certain medications, potentially affecting their effectiveness or increasing the risk of side effects. It is important to inform a healthcare professional about all medications being taken, including over-the-counter drugs, vitamins, and herbal supplements. This will help identify any potential interactions and adjust the treatment plan accordingly. Pregnancy and breastfeeding. Plaquenil should be used with caution during pregnancy and breastfeeding. It is important to discuss the potential risks and benefits with a healthcare professional, as the medication can cross the placenta and pass into breast milk. The decision to use Plaquenil during pregnancy or breastfeeding should be made in consultation with a healthcare professional, taking into account individual circumstances and the potential impact on the mother and baby. Allergic reactions. Individuals with a known allergy to Plaquenil or any of its components should avoid using the medication. Allergic reactions can range from mild skin rashes to severe symptoms such as difficulty breathing or swelling of the face, lips, or tongue. If an allergic reaction is suspected, medical attention should be sought immediately. These precautions and considerations should not deter individuals from using Plaquenil when it is medically indicated. Instead, they serve as important points to discuss with a healthcare professional to ensure the safe and effective use of the medication. Alternatives to Plaquenil. While Plaquenil is a commonly prescribed medication for the treatment of autoimmune diseases and malaria, there are alternatives available. The choice of medication will depend on the specific medical condition, individual patient factors, and the recommendations of a healthcare professional. Some alternatives to Plaquenil include other antimalarial medications. In cases where Plaquenil is not suitable or tolerated, other antimalarial medications may be considered for malaria prevention or treatment. These alternatives may have different dosing regimens and potential side effects, and a healthcare professional can provide guidance on the most appropriate choice. Other disease-modifying antirheumatic drugs, DMARDs. For individuals with autoimmune diseases such as lupus or rheumatoid arthritis, there are other disease-modifying antirheumatic drugs available. These medications work by modifying the underlying immune response and reducing inflammation. The choice of DMARD will depend on the individual's specific needs and response to treatment. It is essential to consult with a healthcare professional to explore alternative options and determine the most appropriate course of treatment based on individual circumstances. Frequently asked questions about Plaquenil. Can Plaquenil be used in children? Plaquenil can be prescribed to children in certain situations, such as when treating specific autoimmune conditions or preventing malaria. However, the dosage and administration guidelines may vary based on the child's weight, age, and medical condition. It is crucial to consult with a pediatric healthcare professional to determine the appropriate use of Plaquenil in children. How long does it take for Plaquenil to work? The onset of action for Plaquenil can vary depending on the medical condition being treated and the individual's response to the medication. It may take several weeks or months to experience the full benefits of Plaquenil in managing autoimmune symptoms. Regular monitoring and follow-up appointments with a healthcare professional are essential to assess the effectiveness of treatment. Can Plaquenil be used with other medications? Plaquenil can interact with certain medications, potentially affecting their effectiveness or increasing the risk of side effects. It is important to inform a healthcare professional about all medications being taken, including over-the-counter drugs, vitamins, and herbal supplements. Thanks for watching.